The Institute for the Study of Pig States presents the 5th International Psychoimmunology and Psychobiology Research Symposium. In this video, a case study, Chronic Lyme Disease Treatment using Psychoimmunology by Dr. Mary Pellicer and Amy Zook.
So, our first presenters today, we've got Dr. Mary Pellicer. So she's a trained family physician. She's based in the US. She's our medical director for the Institute for the Study of Pig States. And Amy Zook, who's one of the members of our applied research team, also based in the US, but currently joining some of our colleagues in Denmark. So, as I said, they're going to go through a case study around chronic Lyme disease. Over to you.
Thank you very much, Shane. Hello, everybody. We're going to talk about Lyme disease. So I'm just going to start off giving very brief background. Maybe some of you have never heard of Lyme disease, or just to set some context. And then we're going to dive into the case study with Amy. So the first question is, why the heck is it called Lyme disease? And the reason is because there's a town in Connecticut in the United States called Lyme. And this is where cases were first diagnosed way back in 1975, where it was found. So that's why it's called Lyme disease. Lyme disease is a bacterial infection. It's caused by a bacteria, which is spread by deer ticks or black-legged ticks. It's a specific kind of tick that has these bacteria in its system. And when those ticks bite a person, they act like little injectors, and they can inject the bacterial infection into the person. That is how a human being gets Lyme disease. The particular bacteria is it's called a spirochete form, which means it's a little corkscrew form of bacteria. And the most common species is a Borrelia burgdorferi. There are some other ones that are implicated as well, but that's the classic bacteria cause of it. So in general, there are 3 stages of Lyme disease that are recognized. There's stage 1 is early localized Lyme disease. And this happens 3 to 10 days after you are bitten by a tick that's given you the bacteria. About 3/4 of the time, there'll be a skin rash involved, which is called erythema migrans. It can look many different ways, but this is often the way that Lyme disease is diagnosed by a person who's been in an area where they might have been exposed to ticks, or they found a tick on them, and a couple days later they'll start to get this rash. In many cases, although not all, there are flu-like symptoms. So people may get chills, fever, fatigue, headaches, joint, muscle aches, just feel like they have the flu. Those can also happen. And at this stage is when treatment is most effective. And generally that's a 2-week course of an antibiotic to kill the bacteria. However, in some investigations, failure rates, even when treated this early, are estimated from 16 to 39%. So a lot of failure rates. So that's stage 1. Stage 2 is called early disseminated Lyme disease. So where it's localized in the skin at this stage, after sometimes more days to months, the bacteria is spread to more parts of the body. And classically, it can go into the nervous system, the joints, or even the heart. And again, symptoms are often very nonspecific, which can make it hard to diagnose. Symptoms such as fatigue, achy muscles and joints, brain fog. So not very specific. And then after months to sometimes years, you get what is called stage 3 or late persistent Lyme disease, which classically will go into the joints, especially the knees, with Lyme arthritis. Again, more nervous system problems, sometimes heart problems, which can be significant, and a myriad of other very nonspecific symptoms, just not feeling well. So in the literature, those are the 3 stages that are defined. Now, I will tell you right off that Lyme disease is not straightforward. Right now in medicine, there's a lot of controversy and not much agreement. So certain medical establishments don't think that chronic Lyme exists. There are a lot of patients that think they have chronic Lyme that are advocating for themselves. It's just kind of a mess. So I'm not going to go into any more detail other than it's an area of a lot of investigation and research trying to figure out what's going on. Now, one interesting thing, and I'll right now go into some of the just one little tidbit that we've seen in the Institute here, is that in the literature, they have diagnosed this bacteria, the Borrelia bacteria, has been seen and described in the medical literature as having what are called pleomorphic forms, so different shapes. So where I said classically that Borrelia is a spirochete, it's these little corkscrews that are swimming around in the person who's infected. But they have also been found as what are called round bodies, so they're now round or spherical, and also in what are called biofilm-like colonies. So these 3 different presentations. And then the research we've done in the Institute, we've actually been able to tune in and perceive these different ways that it presents. So that's quite interesting to us, and some correlation with medicine. The laboratory testing, again, is one of those areas that's very controversial. It's hard to diagnose. Often the tests that are used are looking for the person's antibody response to this. Lots of false positives, lots of false negatives, and again, an area of great controversy. So making a firm diagnosis of Lyme disease as a cause for a myriad of very nonspecific symptoms is difficult. Let me see, is there anything else I want to say? No, I think that's all I want to say. Amy, do you want to say anything about that? I know you've dove in a little bit. Do you want to add anything at this point before we dive into your case? Oh, you're on mute.
I wish I could remember the name of it, but there is a specialty for Lyme doctors who specialize in testing for it, but they are specialists who have a unique testing. I think it's a Lyme.org. You can find these doctors who do a specialized testing that is separate from what they've been doing since the 60s.
Classical, yeah. Exactly. If you do a deep dive on the internet, you can find all kinds of good stuff, and sorting out what can be difficult. But yeah. I think I will just quote Kirsten here: "Is we don't know what we don't know." So we're learning all kinds of things. Okay, yeah. Amy, let's dive into your case. Okay. So you gave me kind of a timeline of symptoms, and I'm just going to kind of go through each one and then ask for maybe just a little explanation what was going on before we get to the denouement. In 1993, 30 years ago, yes? Am I counting right? Yes?
Yeah.
Amy was bitten by a tick. You found a tick on you. Yeah?
Yes.
You were bitten by a tick. And you got a rash afterwards, correct?
Yes.
Okay. And you went to a doctor,
Mhm.
and what did the doctor say, and what did he do or she do?
Well, he said, it could be Lyme. It's a classic symptom, and I should go on this antibiotics because to prevent a chronic Lyme infection. He also gave me a stack of paperwork on Lyme, acute and chronic, which I was young. I didn't read it. He just said, come back in 2 weeks to get reevaluated. Well, I finished the antibiotics and the rash disappeared. So I figured, oh, I'm good. Well, yeah.
Okay. So that's what happened initially. So you actually had a tick bite. You
Yes.
knew you had a tick bite. There's lots of people that get bitten by ticks. These ticks, by the way,
Yes.
are the size of a poppy seed.
Mm.
Hello, a poppy seed. Okay. But Amy knew she got bitten by a tick, had a rash, went to a doctor, and had treatment.
Yes.
Rash went away, all good. So part of what I want you to get from Amy's story is the story of someone with chronic pain. So we're going to go through a little of these, and we don't need to go into detail other than just kind of what happened. So in 1994, you injured your right shoulder. What
Yeah.
happened there?
Yeah. I was playing on some equipment with my stepkids like I always did. I mean, I was very active. I played tennis. I played softball. I played softball since I was 7. And just playing on the monkey bars with my stepkids and felt like I tore my shoulder. And that was pretty much the end of my activity that involved my shoulder for a
Okay.
while.
So you had chronic pain there on and off.
Yeah.
Yeah.
Yeah. Yeah.
In 1996, you hurt your low back.
Yeah. I pretty much really threw it out. I ended up seeing a chiropractor like 3 times a week. My doctor was like, whoa, I can't believe what you've done here. And I was in pretty significant pain.
Okay. Then you had some children in 1997 and 1999 and continued
Yeah.
to have back pain and then had some rib issues after that.
Yeah. I had C-sections, and my first one, I had a rib. I think they spread me, and one of my ribs got impacted, and that became a very sore spot with my subsequent pregnancies. And the low back pain where I'd injured it originally became, I had to wear a support brace during pregnancy once I started showing because of the weight was pulling on that.
Okay. And then in 2000, despite all this, Amy is apparently skiing because she had a skiing accident.
I tried to remain active. I always went to a chiropractor. I tried to eat healthy. I took supplements. I was always trying to just keep living life. And yeah, I did. I started skiing, gosh, in 1993 and tried to keep up with that. And yeah, someone ran into me and I fell with my shoulder up, same shoulder.
Same right shoulder. Okay, so you
Yeah.
re-injured the right shoulder.
Yeah.
In 2001, it looks like you found a chiropractor that was pretty helpful.
Oh, yeah, he was amazing. He reversed my scoliosis. I
Okay.
loved him, and he got my shoulder back in. I still had chronic pain there. It was just constant hurt, but he did get it in, and it was pretty stable, but I couldn't play softball.
Okay.
I
So
couldn't even
better,
throw a
but
ball.
still had
Yeah,
pain. Okay.
yeah,
And then in 2002, you had a third child and developed
yeah.
some,
Carpal tunnel, jaw pain. Yeah, I had significant pain with my third one. Yeah.
third child. Okay. Then we're going all the way to 2014 when you had an accident.
I will, can
Oh,
I kind of missed
absolutely.
something in
Yep.
2010. I was very ill for about 6 weeks. And it turns out I had POTS,
Oh.
post, you can give the name post postural orthostatic tachycardia
Mm-hmm.
and chronic fatigue,
Mm.
many things, which I was being treated for. And so that was the first indicator that I had some kind of chronic problem.
Chronic ongoing problem.
Yeah.
Okay.
And I started seeing a functional medicine doctor then.
Okay. Mm-hmm. And no specific diagnosis other than the POTS.
No, I didn't have insurance. I didn't have money at the time. So he was treating me for just chronic disease and using supplements. He did a lot of labs to check antibodies and for most common things that he ran into. And I did have celiac or at least gluten intolerance at the time. And my C-reactive protein was pretty high, and I had no vitamins. I mean, I had nothing. And my thyroid was pretty low.
Cause problems.
Yeah.
Okay, so a lot of things are going wrong at this point. Okay, and now we're up to 2014.
Yes.
And you had an accident.
Mm-hmm.
Mm-hmm.
Yes, I had an accident which caused significant damage. I flattened my L4, L5.
This was a motor vehicle accident?
Yeah, I was a pedestrian and a guy in a golf cart hit me.
Mm-hmm.
And flattened my L4, L5, tore both my SI joints, damage in my neck region, and I had some bulging discs throughout my spine.
Okay.
And yeah, walking was an issue. I had Kata-Kina syndrome. And so I did have surgery, L4, L5 decompression surgery, and eventually a fusion because that failed.
Yeah, and so for Kata-Kina syndrome is actually a surgical emergency when you have a disc that bulges and it starts to press on the nerves that are supplying the bowels and the bladder, and yeah, that can be very significant if you don't fix it. So yeah, so you were significantly sick with that.
Yeah.
And after all of this happened, Amy, I mean, you'd already been having chronic pain. Did that get worse at this point?
Yeah, I was pretty much a 9 and a 10. I continued to try and move. I was doing PT, but I was in bed most of the time. I continued to work, but I would just come home, try and get the kids fed, and then go to bed.
Mm-hmm. Okay. And then in 2019, you started training with the Institute and took
Yes.
our trauma therapy course.
Yes. But yeah, you found me. I found you. Well, I've known you, but you brought Peak States to Wellness.
And so for those of you who don't know, but it's basically the training for trauma therapists is 150 plus hours of training, and it's learning how to treat all kinds of different subcellular cases. And students practice a lot on themselves and each other. Yes. And during that, so you were using all kinds of tools and such. And what happened with your chronic pain as you were going through the trauma therapy and healing various things that you found in yourself?
My pain level went to about 3 to 5. I started walking and eventually I was walking without dragging my leg behind me. Yeah, it was fantastic. I was able to sit. When I started the training, I was like, I have no idea how I'm going to do this, but I'm going to do it. So
Okay.
We went into the pandemic, so I did it from bed.
Okay. So that's pretty significant from a 8 to 9 pain level, much of the time down to a 3 to a 5. That's for a
Yes.
chronic pain patient. That's huge.
Yeah.
Yes.
Yeah, it was.
Okay.
It was.
A lot.
Yeah.
And through all of this, I know we've I don't know if people are bored or not, but I just want you to hear what it's like in people with chronic pain and all of the things that Amy has been through. Now, in any of this, and with your chiropractors or your functional med docs, has anyone said, I wonder if you still have a problem with Lyme or chronic Lyme disease or
I was
post-treatment Lyme syndrome?
diagnosed. No, and although I was diagnosed with fibromyalgia, and my functional medicine doctor, he started investigating last year what was really going on because I had so many chronic conditions. He started wanting to look into if I had MS or some other underlying issue that was causing all of this.
All
And
these
so,
problems.
right, and insurance was being real fun about trying to get to the underlying cause.
Not wanting to
And
pay for those tests. Yeah.
yeah, and so we were getting stalled out there.
Okay. And at this point, we're up to earlier this year.
Yes.
And by this time, you are a certified therapist with Peak States.
Yes.
And you joined our Kirsten and Grant and I formed a little group to do the phase 1 testing we talked about yesterday and invited you to join us.
Yes.
And earlier this year, or when was that? A couple months ago?
Yeah.
we developed our psychoimmunology treatment for Lyme disease. And we wanted all of you to do the test. And even though none of you said that you had Lyme disease, as I remember,
Right.
but you tested this process.
Yes.
Yes.
And
And go ahead.
I was just going to say, because I work with people with Lyme, it's always been in the back of my mind as they're listing out all their symptoms. And it's always been in the back of my mind going, I have that, I have that. And then I'd be like, well, I got run over. Well, I have this. Well, I have that. You know what I mean? So I'd always discount that I have the same thing.
Got it. But you could see a lot of your symptoms in them. But these symptoms again are pretty non-specific, right?
Exactly.
And you had all kinds of, I mean, ski accident and motor pedestrian accident and tore your shoulder. I mean, you've had all kinds of reasons for chronic pain, right? Okay.
Right.
But so during the treatment, when we were testing this, we were basically guiding you to treat a specific generational trauma.
Yes.
You were monitoring, as I remember, some areas in your body.
Yes, I was.
Mm-hmm.
And I totally didn't believe the pain would go away.
Okay. So you didn't believe the pain would go away. Now you have, I don't know how many different areas in your body you still had some pain at this point. Did you have any sense of which, as you're starting to go along and kind of paying attention to things, which might be due to Lyme or not? Did you have any indication of that?
Yeah, that I had 3 specific spots that I was monitoring that I was pretty sure were due to Lyme.
And what were those spots? Okay, based on the markers.
My shoulder, my hand, and my neck.
Okay, all right. And just tell us a little bit, how was the process to do? I mean, you're a pretty seasoned therapist and do a lot of treatment on yourself as well as guiding clients through it. But how was the process for you? Oh, we're losing you.
Honestly, it's pretty simple. Oh, hello?
You're back.
Can you hear me? Okay. So it's a very simple process, even though I'm seasoned, even when we first started earlier this year. The process is very simple. And like I said, as I'm doing it and I'm saying, well, no, the pain's still there. And I think Grant said, no, it's going to be completely gone. I'm like in my head thinking, come on.
Okay.
It's not related. I tore my shoulder.
Okay. So you finished the process and as you were guided, it was doing the process of how to tell when you'd completed the process. And when it was done, and again, every time we do this, we repeat it 3 times. Yes?
Mm-hmm. Yes.
Okay.
And
so do you believe that you completed the process?
Oh, yes, I absolutely believe. And when
What
we
happened?
completed the process, my pain was gone.
Like
it was
zero?
zero.
Gone?
It was zero.
Okay. Where was it zero?
It was in my shoulder, my neck, everywhere. On that day, I had zero pain.
Mm-hmm. Okay. Interesting. And what has happened since then?
I had so I do have shifting ribs, and so I was able to treat that with just regular trauma therapy. And
So that
today,
didn't seem to be due to your Lyme's.
No, no,
Okay.
it's just regular trauma therapy. And anyways, as I sit here right now, my back, my shoulder, my neck, nothing.
You seem a little choked up.
I'm a little
how does
choked
that
up
feel?
because I've been living in pain for 30 years. So sorry.
No, don't apologize. Yeah. Amy, thank you for sharing that and being willing to go through all of that. And the reason I did it this way, and I wanted you to tell your story because as a family doc, when I was in private practice, there are so many people that have a story just like yours. Now, not all of those people are going to have Lyme disease,
Right.
but the key thing I want people to hear is, number one, Lyme is complicated and it can be totally missed. So you were never diagnosed with chronic Lyme despite trying to get help for this. So it wasn't even suspected, which is a huge problem out there.
Right.
And you were looking. And when you did this treatment, your pain went completely away. Even though I do this all the time in research, it still blows my mind. As a physician, it's like, holy shit. That is so amazing. And that's why I do what I do, right? Because of stories like yours. And the thing is, it's not about taking antibiotics. And that's one of the things that people with chronic Lyme are taking multiple antibiotics, and there's a lot of problems with those. Now, we'll have to follow up because we don't know what we don't know to see how stable this is. But right now, this is very stable with you. And basically, those areas that you think were from Lyme disease are now zero pain, which is pretty cool. And the thing, again, not knowing per se what's going on, but what I'm thinking is that Lyme disease hides out in our body. Remember, I told you about those different pleomorphic forms. And when I think in the literature, there's some indication what's going on. And maybe when there's antibiotic treatment or the Lyme is kind of going into hiding, going, okay, this space is danger, I'm going to change and hide out. But those become areas that are prone to inflammation. And if there is an injury, like the injuries that you had, it sets up some chronic inflammation. At least in my head, that makes sense of maybe what was going on. And when with these treatment, what it does is it eliminates that pathogen from your body. And the thing that we see over and over with this is, right away, when the treatment is absolutely done, the symptoms are gone if they're due to that, which is pretty darn cool. And I know we're reaching the end of our time here. Let me see if there's any other things that I want to say. Okay, the last thing that I want to say about this, and then I'll let you have your say, is that this this Lyme disease process using psychoimmunology, it shows such great promise as an effective and efficient approach to permanently alleviate the symptoms that people are experiencing from chronic Lyme disease. Now we have more work to do. How do we diagnose? How do we find these people that have it? How do people tell if the symptoms and the stories like yours that they have chronic Lyme? I mean, that's something that we have to negotiate, and we're hopeful to work with people in the field and those that are docs that are and healthcare workers that are specifically focusing on Lyme. But we think we have something to really bring to the field that hopefully will touch many people's lives and alleviate a whole heck of a lot of suffering. Amy, you have the last word, and then we'll turn it over back to Shane. And what do you want to say?
One thing I want to say to that is I never accepted a fibromyalgia diagnosis. And when someone tried to say that, one of my docs, I said, no, take that out of my file. I do not have that. I said, I know for sure I have chronic costochondritis, but there's an underlying problem. Take that out of my file, because once they do that, they don't search for the underlying cause. And I tell that to people I work with. I say, keep searching. There's a reason. There's something underneath it. It's not fibromyalgia. There's something causing it. But, maybe there is fibro. I do believe there's something underneath it. So,
all right.
And it may not be Lyme. It could be something else.
It could be something else. All right, Shane, back to you. I know we used up our time, and if people have questions,
that's okay.
We'll have to do it later.
So I've got a question from Evan asking, Amy, have you tested for any Lyme antibodies left in your blood?
No, I have not. The most I've done so far is C-reactive protein, and I get that monitored regularly. And it's pretty low right now. So,
was it low before?
It fluctuates.
Yeah.
And so I will probably get see how it does over maybe the course of a year. I get it checked about every 3 months. So.
And C-reactive protein is a marker for inflammation of all kinds. So it's not specific at all for Lyme's disease. And Evan, part of the problem with this is that testing for these things, number one, they're expensive and it's controversial. And that will be one of the things we're going to do going forward as we're rolling this treatment out, is look at what if someone does have markers in their blood, and blood tests and antibody tests and such are positive. How do those change? And so those will be more to come. Maybe next year at the symposium we can do this again and we'll have more data.
Excellent. Okay, well, that's probably time. Thank you so much for sharing your story, Amy. It was very moving to hear how much of a difference it's made in your life, which is one of the things as therapists doing this work, we love to get that feedback. So thanks for sharing.
Thank you for watching. For more information, please visit www.psychoimmunology.com.au.